Welcome to this video on what should prevention really look like. The subject matter revolves around the question of how can we prevent all the major chronic illnesses we currently are facing. Here is a very quick rundown of the broad categories of topics we're going to talk about. A couple different ways to think about this subject of prevention. I am going to be going through examples of heart disease, diabetes, and cancer, looking at some of the current rates of these illnesses in our population, and then focusing on what are the real root causes of these illnesses, what mechanism of actions are causing these illnesses to progress, and therefore that leads us to the foundational approaches we need to actually prevent them. So for those who haven't met me yet, haven't been exposed to some of my work, I began my professional life as an engineer and manager in the aerospace industry. One of the things that did for me was develop a really good mastery and understanding of the scientific process. I then made a life change, career change to move into the world of holistic medicine. I've specialized in a number of things listed here. I have a podcast I produce, Total Health with Dr. Cage, as well as maintaining a private practice and wellness clinic in Hamilton, Montana. A few other things. The full biography is on my website, www.drcagesays.org. So a moment ago, I alluded to the leading causes of death in the United States, the major chronic illnesses, as we sometimes call them. These data are from 2017. Heart disease still number one. Cancer is closing the gap as a second leading cause of death. Accidents has actually moved up in the last 10 years. Respiratory disease, so primarily pneumonia, primarily among the elderly. Cerebral vascular diseases, that means strokes. And that's really the same exact constellation of causes as heart disease. Alzheimer's has moved up a slot, diabetes has moved down. So today we're looking at heart disease, cancer, and diabetes. But this is the problem. This is what we're dealing with as a culture, and this is why we need to start preventing these rather than waiting until we have one of these diseases and trying to prevent it and trying to treat it. So let's get started. There are two basic ways to think about prevention. These are the ways that are currently in use in the two major categories of medical systems we have here in the U.S. The conventional medical system, this is the standard of care in the medical world, the hospital world, the medical doctors, and that whole world. Prevention has come to mean making an earlier diagnosis so that we can start the standard of care treatment sooner. And in theory, that's going to result in a longer lifespan and a higher quality of life. What that conventional method of prevention does not include, however, is the concept of curing the disease, of reversing it and eliminating the disease. Now, for most of the diseases we're talking about today, in actuality, the earlier detection and treatment very seldom extends the lifespan and in some cases may actually shorten it. In the world of natural and holistic medicine, our definition of prevention is that the person in question does not get the disease. It is really hard to measure for any one individual. This means it's tough to measure something that didn't happen. So the way we figure this out is through statistical analyses of large populations over time. We in the natural holistic world have an underlying assumption that all illnesses can be cured. Now, there may be an individual at some point who is beyond the point of no return. That can happen. But we start with the assumption that everything is curable until proven otherwise if we do the right things. And the right things revolve around using a model of the healthiest and longest lived populations in the world and using that model as a basis and a guiding waypoint for treatment. So to accomplish all that, the naturopathic medical profession combines the best of modern medical science, the best of traditional knowledge, and the best of practical experience. And by that we mean empirical data that is actually where all science starts, is by looking at something and seeing trends. For anyone who is not familiar with the naturopathic medical profession, like all the other doctoral level professions, we go to 4 years of medical school after 4 years of undergraduate college. We cover all the basic medical sciences, diagnostics, and then focus on treatment using natural holistic medicines. And we have our own version of board exams, licensing boards, and so on. Philosophically, naturopathic medicine works in harmony with your body's natural ability to heal using the safest methods possible. On this chart, I'm showing the lowest rates of heart disease in the world. This is from 2020. It's relatively recent. So the lowest rates, where higher rankings, number 1, 2, are better than lower rankings. So Japan, number 1. As an aside, Japan's also number 1 in average lifespan in the world. France is number 2. Then moving on down, Canada, Republic of Korea, Iceland, Spain. Switzerland, number 7. They actually have the second highest lifespan in the world right now. New Zealand, Netherlands, and Italy. You notice United States is not in the top 10 for having the lowest rates of heart disease. We currently rank 41st as of the year 2020. So whatever we're doing in the United States, I think we need to improve it. Next up, type 2 diabetes. Estimated prevalence in the United States, about 37 million people, or 11% of the population as of 2019. And these numbers are getting a little worse in terms of who all has diabetes to deal with. It did drop down a notch in the leading causes of death. So people with diabetes aren't dying quite so much as they once did, but this is still the most expensive illness to treat over the life of a patient, and it is one of the illnesses that has the biggest negative impact on quality of life for most patients. So just a few words about type 1 diabetes. The situation is much more complex and not suitable for this prevention lecture. But this is unfortunately something where the United States ranks number 1 in the world, which is the number of cases of type 1 diabetes. We rank higher than everybody by quite a bit. So this is just to put all this in perspective. Whatever the advertising, propaganda, whatever the television and internet say about the wonders of the United States medical system, the numbers don't back that model up. That brings us to the third illness I wanted to show some statistics on for our discussion today. The worst cancer rankings by country. And these data are from 2018, about 5 years ago now. We were ranked 5th. So cancer rates, that's per 100,000 population. We are in number 5. I'm actually pleasantly surprised. I guess we're not any higher than that. But we still have a lot of room for improvement. Now, of the 50 countries with the highest rates of cancer, I showed this down here at the end, just because this is where Japan is. They're number 43 in cancers. Israel is number 50. What isn't shown in the data I was able to find is the countries out of 178 countries that are tracked that are lower than this. So that's some more research I'll be doing over time, and who knows, I'll probably update this lecture at some point. All right, let's move on with our examples. Example number one, first up is heart disease. We'll take a look at that. A really quick overview of the progression of heart disease. It generally begins with inflammation inside our arteries. The body produces extra cholesterol to lay down as plaques to prevent blood from leaking out. If the inflammation causes a hole in the wall of the artery to develop, blood leaking out of arteries could potentially kill a person quickly. Those plaques cause arterial flexibility to decrease, which means the heart has to work harder to pump the blood, and our blood pressure goes up. Keeping adequate levels of oxygen going to the brain is the number one determining factor in blood pressure. Over time, the heart begins to hypertrophy, meaning the muscles enlarge. You might hear the term enlarged heart. That in turn leads to a decreased ejection of blood each time the heart beats. That's something known as the ejection fraction. And eventually blockages of the cardiac arteries, which supply oxygen to the heart and nutrients to the heart, those blockages can lead to a heart attack, also known as a myocardial infarction. So that's the disease process. What triggers it? Well, the key is arterial inflammation, and arterial inflammation occurs secondary mainly to two big categories: essential nutrient deficiencies and the presence of environmental toxins. Among the nutrients that the heart needs the most are the essential fatty acids, also known as the omega-3 oils, as well as the mineral magnesium. Environmental toxins includes quite a few, so smoking, excess alcohol consumption. Moderate to low levels statistically shows to be okay for heart disease, especially red wine. In environmental toxins, there's a lot. Heavy metals such as mercury accumulates in the heart. Diesel exhaust fumes, very specific. And all these pollutants cause pro-oxidative damage to tissues and to the heart muscle itself and to the blood vessels in the body. Another contributing cause, poor quality nutrient excesses, so pasteurized, homogenized milk products, hydrogenated fats, simple carbohydrates are the big ones for heart disease. Other lifestyle factors, such as a lack of exercise, being overweight, all contribute. All right, let's move on to example number two, which is diabetes. So diabetes is a disease of insulin resistance. And what that means is when we normally eat a meal, blood sugar rises, and that causes the pancreas to release insulin, which is intended to tell other cells in the body to absorb that blood sugar. The cells targeted are unable to absorb the insulin, and hence the blood sugar is not absorbed into the body. The blood sugar levels stay high, and that is what begins to cause tissue damage. The most common causes of insulin resistance include deficiencies of iodine, deficiencies of essential fatty acids, the omega-3 oils. The essential fatty acids are needed for cell membrane flexibility, and the iodine is needed to activate the hormone receptors so insulin can be absorbed. Other trace minerals are involved in this process, such as chromium, zinc, and another one known as vanadium. So those high blood sugars begin to create an osmotic imbalance between the blood and the cells lining the blood vessels, which eventually causes the small arteries to break down and circulation to the distant regions of the body drops, lowering circulation and oxygen, and that is the beginning of the tissue damage. So the key organs are the kidneys and the vision. The peripheral circulation is what will be most affected. That can lead to the need to amputate feet. Eventually, the pancreas wears out. It loses the ability to even produce enough insulin. And then people become insulin dependent, meaning they have to take injections when they eat meals. Most diabetes deaths ultimately are the result of kidney failure when that osmotic imbalance destroys the many fine blood vessels in the kidneys, and that leads to whole body electrolyte imbalance and death. Here we have a graphic that's summarizing this situation I just described verbally. Here on the left, the blood sugar goes up after eating. The pancreas releases insulin, which tells body cells to take up more glucose, and then that causes the blood sugar to drop, and then the pancreas releases the opposite hormone called glucagon, which tells the liver, which has stored a lot of that blood sugar, to start releasing some. So there's a natural cyclic process here. So as I alluded to a moment ago, for type 2 diabetes, essential nutrient deficiencies, especially of essential fatty acids, iodine, and trace minerals, poor quality nutrient excess, such as the bad fats and simple carbohydrates and sugars, a lack of exercise, because muscles can absorb blood sugar without insulin during exercise, that is. And for type 1 diabetes, here in modern times, the number one cause is almost universally vaccination side effects. All right, example number 3 is cancer. So this graphic is showing us the increase of cancer and well as projections into the future starting at about 1975. In my experience, these numbers are low. I've seen other data that suggests cancer rates are higher than this now, but this was one of the best graphics I could find to show the steep rise of this disease. Cancer used to be called the C word. We didn't talk about it in polite company. It was viewed in a similar vein as mental and emotional illnesses, where it was kind of assumed the person with the illness was viewed as having done something wrong. I remember as a child observing that reaction among all the adults in my life whenever anyone found out that, well, someone they knew had cancer. Prior to the mid-1900s, cancer rates were generally less than 5% of the population, really less than 3%. It happened, but it was really rare. But you fast forward to today, and rates between 20 to 30% of the population, and in a few cases higher, has become the norm. As far as the main mechanisms of cancer, Otto Warburg, a German physician, won the Nobel Prize in Medicine in 1931 for demonstrating that normal cells deprived of oxygen will convert into cancerous cells, and a certain percentage will convert back to normal when sufficient oxygen is restored. Some cells have been proven to become cancerous when exposed to ionizing radiation, which will damage the DNA. Many other toxic chemicals can cause cancer. A big example that's been in the news a lot lately is Roundup, which is a common herbicide or weed killer. Smoking, huge cause. It introduces both toxins into the body and reduces oxygen. Heavy metal toxicities have been known to cause cancer, primarily because they disrupt electrical conduction at the cellular level. And there is some evidence that some cancers may have an infectious component, whether that component is causal, and there's evidence for that in cervical cancer, or is merely an association of a compromised cell being colonized by organisms, and either of those combined with a depressed immune system. There is evidence that exists for both of those theories. It's not the only cause in many cases. In addition to those root causes, there are many essential nutrient deficiencies that have been shown to be associated with or cause cancer. One example is the mineral selenium, which is a trace element. We don't need much of it, but it's protective for all cancers. Many other nutrients and foods are known to be protective against cancer. So in other words, high levels of nutrients equals low levels of cancer. The foods that are really good at this are the cruciferous vegetables, such as broccoli and cauliflower. The carotenoids, the carotene families, red and orange fruits and vegetables, and the bioflavonoids, blue and purple fruits and berries. So to summarize these major root causes of cancer: lack of oxygen at the cellular level, ionizing radiation, such as from medical imaging, nuclear fallout, or frequent high-altitude aircraft flights, toxic chemical exposures, smoking, a compromised immune system, a variety of infections, and a variety of nutrient deficiencies. All right, now let's put all of this into kind of a summarized package of the major chronic illness root cause commonalities. So reviewing the summary again of the root causes of heart disease: nutrient deficiencies, environmental toxins, an overload of poor quality foods and nutrients, and a variety of lifestyle factors, especially a lack of exercise, being overweight, and smoking. So now adding in diabetes, the root causes are nutrient deficiencies, environmental toxins, poor quality foods, and lifestyle factors, especially lack of exercise. And the root causes of cancer include nutrient deficiencies, environmental toxins, poor quality foods, lifestyle factors such as smoking, a lack of oxygen at the cellular level, a compromised immune system, and a variety of infectious organisms. What this tends to show us is that if you work to prevent any one of these three major illness categories, let's say by working on nutrient deficiencies, environmental toxins, eliminating poor quality foods and getting your nutrients, and upgrading your lifestyle, the bottom line is you're also working to prevent all of them. Details may vary slightly, but the overall concepts are the same. So what these three charts we've just seen for the root causes of these three major illnesses is that there's a formula. If we're going to reverse those root causes to prevent these diseases from happening, we need a high quality nutrition program. We need a general purpose detoxification program. We need an essential nutrient supplementation plan, and we need a lifestyle upgrade plan. And there, ladies and gentlemen, is the overview of what I do in my clinical practice. Well, as the saying goes, but wait, there's more. In addition to those four major groups of things we just looked at, there's a number of other condition-specific prevention items that we can address, what to do in addition to nutrients, high-quality foods, nutrient supplementation, detoxification, and lifestyles. And this becomes important if you are already moving in the direction of one or more of these illnesses. So for heart disease, I'm going to talk really briefly about some tests that we want run. Homocysteine and C-reactive protein are very specific to looking at inflammation in the blood vessels. The total cholesterol to HDL cholesterol ratio is way more important than the total level of cholesterol. We measure the waist, we measure your hips, and that ratio based on male or female tells us a lot about your risk for cardiovascular disease. We measure your percentage body fat, not the BMI. I have another video on my YouTube channel that talks about why BMI is such a bad measurement to use on individuals. Heavy metal testing and food allergy testing are all things I have found very, very useful in helping patients with heart disease. The key supplements: omega-3 oils, hawthorn berry extract. L-arginine is an amino acid that stimulates our body's natural production of nitric oxide, which is how we naturally heal inflammation in arteries. L-arginine's role in doing that actually won a Nobel Prize. Magnesium orotate, very specific form that's absorbed most by the heart. If you have elevated homocysteine levels, meaning you have high levels of inflammation in the arteries, the combination of vitamin B6, B12, folic acid, and trimethylglycine actually will clear the homocysteine out and help resolve that quickly. Resveratrol is a bioflavonoid-like substance. Celery, onions, and garlic help thin the blood and lower blood pressure, and eliminating the pasteurized homogenized cow's milk dairy products. Anything else beyond this definitely requires you to be working with a natural health provider such as myself or any other good naturopathic physician in your local area. There's another bit of research I wanted to include here today regarding prevention, right? Famous study conducted at Ohio State University. They were trying to give rabbits atherosclerosis by giving them a bad diet. And then once they had the rabbits having atherosclerosis, they would treat them and try to figure out, does this new drug work? Well, they had the rabbits divided into 4 different groups in 4 different buildings, and 3 of the 4 groups showed very predictable atherosclerotic changes. 1 group did not. They had at least a 60% lower rate of atherosclerosis, and the researchers started investigating why was this batch of rabbits not getting sick. They couldn't find any change in the diet or test conduct that would explain the difference. Well, one day, by coincidence, they were in the lab at feeding time, and the technician assigned to care for them took each animal out of the cage, petted it, stroked it, talked to it, and then she put it back. And she did that with every rabbit in the group. And all of a sudden, one of the researchers realized, hey, wait, she's not doing that in the other groups because she wasn't feeding the other 3 groups. Were other technicians, and they had been there at feeding time, and none of that was happening. It finally dawned on them what was happening. So yeah, she reported that she did that with every feeding just to be nice to the rabbits. Well, they decided to see if they could replicate that study, and sure enough, they could. Love, touch, and intimacy are protective for heart disease. So use that as you will. The Journal of the American Medical Association in 2019 published a study showing the association between push-up capacity, exercise, doing push-ups, and future cardiovascular events. So they looked at otherwise active, healthy men. I think if I remember right, these were firefighters. So these are already people at the healthier, more athletic end of the spectrum. And what they found is that those who were able to do 40 push-ups over the next 7 to 10 years were significantly less incidence of cardiovascular disease compared with those who could do 10 push-ups or less. So exercise helps. As stated earlier, diabetes is the most expensive illness to treat over the lifetime of the patient. It also makes almost every other disease or condition you might have worse. And so the big things here are nutrition, exercise, and developing a daily discipline. Real quickly, I want to present some of the data about complications of diabetes in the United States. So heart disease and strokes, 2 to 4 times higher if you have diabetes than if you don't. High blood pressure, 75% of adults with diabetes had high blood pressure compared to much lower rates if you don't. The #1 cause of new cases of blindness is diabetes. Kidney disease, of course, this is ultimately what causes the death of most diabetics. So to start reversing this, it requires a high level of commitment on the part of each individual, high doses of essential nutrients, lots of minerals, iodine, omega oils, and getting on a realistic weight loss program. I generally ask my patients that I work with who have diabetes to commit to a year of working with me. So a little bit more on diabetes supplementation that we're going to be talking about if you come in to work with me or get online to work with me. Chromium, vanadium, and zinc are the minerals that are key, along with iodine. Essential fatty acid, and feel free to pause this video on any one of these slides to take notes. Iodine, and in some cases glandulars. These are nutritional supplements made from animal organs once the animal has been butchered to be eaten. If you are dealing with any one of these chronic illnesses, would like to get a more aggressive prevention program going, here's some basic information about my clinic. I work with patients in person, of course, here in Hamilton, Montana, as well as online. I've had clients all over the world: Europe, North America, South America, Asia, and even Australia. So please just give me a call, shoot me an email, and I'll be happy to work with you. That's what I do. I have several packages, as well as a pay-as-you-go program. The boxes on the right talk about the Get Healthy, Get Serious program. It's kind of a starter package. That's still available. Will probably run throughout the rest of this calendar year, and then that one will probably go away. That gives you about 5.5 months to get on board with that. If you're dealing with heart disease, cancer, diabetes, as I mentioned, those are long-term. They require some choreography. And when you add up the numbers, the Concierge Medicine program, paying for a year up front, is going to save you a lot of money. I also have my online Patreon Health community where you get access to courses and videos of previous courses. And it's a way, like the bottom tier there is a way to pay for the Concierge Medicine program over a period of time. I also have on my website the 3 books I have out right now. More are in work. Stay tuned. I hope to get 1 or 2 more out by the end of this year being 2023. So keep your eyes on my book page on my website. Heal Your Life, Heal the World is a good one. Keep Your Gallbladder, and then the energy medicine system I teach, Akadua Energy. To help spread the news that you can be healthy and live long, I have a podcast, Total Health with Dr. Cage. It is hosted on the Podbean platform and is also available on many other podcast distributors. Come to my homepage, my drcagesays.org. Under the media section, there is a podcast link, and that will take you to the page on my website, where the widget has the 10 most recent podcasts you can listen to from my website, as well as I have the link where you can click over to get everything I've produced on the Podbean site. And that is it for this video. Thank you for watching. I appreciate it very much. I am available if you email me or call me with questions or to set up an appointment. Hopefully most of you will be able to get started on the basics of prevention, and you won't have to see me unless you're a little further along and need some help getting that process choreographed. So anyway, that's it for today from Dr. Cage. So long and good health.